Assalamu alaikum everyone. Today we'll see about the surface marking of lower limb. So first one is femoral artery. First point is between the anterior superior iliac spine and the pubic crest. A midpoint between that, and second point is in the adductor tubercle, and join these two lines, that is the midpoint between the anterior superior iliac spine and the pubic crest and in the adductor tubercle. This when we join these lines, its upper two-third, here upper two-third represents the femoral artery. This is a, and if you want femoral nerve, lateral 2 centimeter thick is the femoral nerve. That don't ask, just you say about the femoral artery. This is a femoral nerve, 2 centimeter thickness, lateral to the femoral artery. So this is all about the femoral artery. Next we'll see about the dorsal pedis artery. This point is a midpoint between the medial and the lateral malleolus. This is the first point between the medial and lateral malleolus, and second point is a point between the two intercarpal cleft. First two intermetacarpal cleft. Where is the second point? When we join these 2 points, this represents the dorsal pedis artery. Second is done. Next we'll see about the great saphenous vein. So first point for the great saphenous is a medial margin of the dorsal venous arch, first one, and the second point is in front of the medial malleolus. This is a medial malleolus, and in front of it is the second point. Third point we'll see will go along the medial border of the tibia, next behind the knee. This is the third point. Then it runs obliquely on the medial side of the thigh. It runs obliquely and ends in the great saphenous opening. Here is a great saphenous opening which is present 4 centimeter below the pubic tubercle and 4 centimeter lateral to it. This is a space for the saphenous opening where the great saphenous vein ends. This is all about the surface marking of the lower limb. Thank you for watching. If you like this video, please like, share and subscribe my YouTube channel. Thank you.